Hello, good afternoon everyone, and welcome. My name is Sahara. I'm gonna present PowerPoint about breast cancer prevention. So please sign your name on the signing sheet over there and have a seat. I put in front of everyone a copy of the PowerPoint presentation to keep it. And there is a question and answer sheet. We will use it at the end of this session, okay? I'm a graduate student at Texas Women's University in Health Studies program. This presentation for my lessons plan assignment at Strategies in Health Education Delivery course. I'm pretending today to be a health educator talking about breast cancer prevention. Today I want to share some important information about breast cancer. This is a new mission at your Life Better Club at Rosenberg Consolidation High School. And I get invited to your club to present some facts on what is known and not known about breast cancer. I'll also give you some suggestion for what you can do to stay healthy now and in the future. As diagnosis and treatment for breast cancer improve, more and more cancer patients are surviving their diagnosis and surviving longer. Approximately 90% of those diagnosed with breast cancer now survive. In addition, about 2,550 new cases of breast cancer are expected to be diagnosed in men in 2018. Okay, so I'm gonna ask you please to introduce yourself, everyone, and if you ever have known someone with breast cancer, and if you are agreeable to share a brief story about them, please do. Also, I'd like you to say how you or your family did to support that person while they were dealing with cancer. Go ahead. Thank you. In a few seconds, I will start present breast cancer possible prevention through a PowerPoint presentation, and if you have any question, please stop me and ask. The presentation will show on the screen here. So we're talking, as we said, as I said earlier, about breast cancer prevention for class Health Studies 6453. I put the title for this presentation as a question. I said the title, what should I know about reducing the risk of breast cancer? First of all, we need to know what is cancer. Cancer can start any place in the body. It starts when cells grow out of control and crowd out normal cells. This makes it hard for the body to work the way it should. Cancer can be treated very well for many people due to earlier detection. That is the mainly we are talking about today. How common is breast cancer? After skin cancer, breast cancer is the most common among women, but men can get it. Many people don't realize that men have breast tissue and that they can develop breast cancer. What is most common breast cancer types? Invasive or infiltrating means that the cancer cells have grown out of the ducts or lupulus and into the nearby breast tissue. Invasive cancer have the potential to spread out of the breast to lymph nodes and other organs. Invasive ductal carcinoma and invasive lobular carcinoma are the most type of breast cancer. I have some anatomy of normal breast over here and abnormal breast over here. So as we see in the normal breast anatomy, we have the nipples here with multiple opening, and we have the areola, which is the area around the nipple, and we have the milk duct, and we have the milk producing gland, which is this one connected to the milk duct, and the ribs in the back, front of the ribs, the muscles, and front of the muscles, the fat around it, the glands. This is a normal breast. This is the abnormal breast. We have the same anatomy except the tumor. The tumor is not as a green color. They put it as a green to let you differentiate between the glands and the tumor. So the tumor might be attached to the gland as we see here. Okay, so closer to the tumor, and this is the gland, and this is the tumor, so it's attached to the gland. And this is the normal breast as we said before, okay? This is a side view for sure for the breast. How can I reduce my risk of breast cancer? So while no one can predict exactly who will develop breast cancer, there are ways to help protect yourself. This presentation I have today describes specific simple steps you can take that may help you lower your breast cancer risk through adopting a healthy lifestyle and getting regular screening to detect early sign of the disease. If breast cancer run in my family, will I get it too? Some people will ask this question. Family history is one factor that may increase your risk of breast cancer, but it does not guarantee that you will one day have the disease. In fact, researchers estimate that only about 5 to 10% of breast cancer can be attributed to identified inherited genetic factors. Does early detection really make a difference? Yes. The sooner breast cancer is found, the more successfully it can be treated. If a tumor is detected while it is small and well localized in the breast tissue, the 5 years survival rate is 99%. But survival rates drop when the tumor is larger and has spread to lymph node or other area of the body. What are the risk factors for breast cancer? Age and health history can affect the risk of developing breast cancer. Anyone can develop breast cancer, but the following factors put you at higher risk. As I sorted here, the gender, the aging, genetic risk factors, family history of breast cancer, personal history of breast cancer, certain non-cancer breast problems, previous chest radiation, postmenopausal hormone therapy, recent use of hormonal contraceptive, and the race, the dense breast tissue, not having children or having them late in life after age of 30, more menopausal, more menstrual cycle, like the people who, the woman who starts their cycle very early and it ended too late or late in their life, no breastfeeding, physical activities, overweight, alcohol use. Be alert to possible symptoms and look for it, okay? So I have here drawing about the symptoms of breast cancer as a self-check. So if you find the lump, if you find the pulled in nipples, dimpling, dripping, redness or rash, skin change, so all of these signs you need to be aware about it daily. Early detection save lives. So breast self-exam, as I said the previous slide. So clinical breast exam through go to the clinic and let the physician do clinical breast exam for you, and mammogram, which it can be as these pictures with a low radiation. Diet and lifestyle, important risk factor you can control. Some of the choices you make every day can lower your chances of developing the disease. The following risk factors are the most significant. Physical activity. As everybody knows, the physical activity is very important. Adults should engage in at least 150 minutes of moderate intensity or 75 minutes of strong intensity activity each week, or an equivalent combination, if possible, spread throughout the week. Alcohol drinks. Compared with non-drinkers, women who consume 1 alcoholic drinks a day have a very small increase in risk. Those who have 2 to 3 drinks daily have 20% higher risk than women who don't drink alcohol. Breastfeeding. Some studies suggest that breastfeeding may slightly lower breast cancer risk. Body fats and balanced diet. Get to and stay at a healthy weight throughout life and eat healthy. Now I'm gonna give you a 10 minutes break, and we have some bottle of water over there. The restroom, once you get out of the door, it's gonna be on your left side. So come back after your break, and we will do the question and answer sheet together. Thank you, and I'll see you soon. Okay, welcome back. I put front of everyone a sheet of question and answer. Let me read the question for you. There are several ways for to reduce your breast cancer risk. Which of the following will you apply to your life behavior within the next 6 months? You can select one or more, or all of them if you like. A. Maintain a healthy weight. B. Eat a healthy diet. C. Become physical active. D. Stop smoking or use tobacco. E. Limit alcohol consumption. F. Know your family history. G. Get screened. So I'm gonna ask you please to answer this question, and you don't have to put your name on the sheet, and after you finish, just to put the paper here up front. I'm gonna wait a few seconds or few minutes, okay? Okay. Thank you for answering this question. Okay. Before we go through that question and answer sheet, if anybody has a question, please ask. Okay. So the question about you ask about cancer in men. Okay, for men, the lifetime risk of getting breast cancer is about 1%. So 1 out of 1,000 men can get cancer. Okay, your question, please. Yeah, lung cancer, yes. Lung cancer is the number one cause of cancer related to death in United States of women. That's true. The number one cause of death overall in women is cardiovascular disease. This is though to mainly be due to earlier detection and improved treatment. Decreased incidence may also be a factor. Okay? Yeah, the difference between ductal cancer and lobular cancer. The ductal cancer, some start in the cells that line the lupulus. And the lobular cancer, while a small number start in other tissue. Yeah, that's true. The ductal starts in the ducts, lobular start in the lupulus. That's true. Okay? Yeah, the cancer kind of related to inherited gene mutation. Are in every cell of the body, and they can be passed on to children. This mutation can increase the risk the risk of for developing cancer and are responsible for the cancer that run in some families. That's true. Yeah, it's inherited. That's true. So, for example, the BRCA gene, BRCA1 and BRCA2 are tumor suppressor gene. Mutation in these genes can be inherited from parents. When they are mutated, they no longer suppress abnormal growth, and cancer is more likely to develop. Yeah. That's why we have to recognize or be familiar with our family history, or we can run this kind of gene lab test. It's called BRCA. Yes, the risk factor don't tell us everything. That's, yeah. Having a risk factor or even several risk factors doesn't mean that you will get the disease, and some people who get the disease may not have any non-risk factor. Even if a person with breast cancer has a risk factor, it's often very hard to know much that risk factor may contributed to the cancer. Still, researchers have found several risk factors that may increase a woman's chance of developing breast cancer. But we try our best. So early detection is better. Follow the risk factor risk to avoid any breast cancer. It's better than ignore it, like physical activities, be diet, reduce your alcohol consumptions. All of this related to avoid the risk of breast cancer. Okay, so let's look at your answer for questions. Anybody has any other questions? Okay, so let's look at your answer here for the question I get from all of you. Okay, so for that question, some of you select several answers, some of you select few answers. So if you have any question about any of these answers, please let me know. And all of them actually require to be done. So eating healthy, do physical activity every week, know your family history, get screened every year or self-screen every day. And if you found any symptoms, any sign in your breast, just go ask your doctor, no hesitation, and stop smoking or tobacco. It cannot prevent any other kind of cancer. And maintain your healthy weight. It's very important. And all of these factors is very important for us as a life behavior, to change our life behavior to be healthy. I put some references here in the PowerPoint, so if you like get more information about the presentation I did, you can open any of this website to get more information about it. I'm gonna leave also my business card. If you like to email me, you can email me with any question. And I know all of you young to hear this kind of session, but you gonna graduate very soon, and some of you will go to medical school. Some of you will be maybe a health educator, or will work in a lab, so or work in any other career. But be aware about breast cancer, be healthy from now, advise your family member, and share this information for everyone in your community. So we need be a healthy country. Okay, thank you very much for coming and for listening to me, and I wish you a better health, a good health all the time, and thank you for inviting me today. Thank you, and goodbye.